Okay, so now we're going to look at the inside of the heart, and we're going to follow the blood, how it would pass through the body. So we're going to start with saying that the blood has gone through the body and it's deoxygenated. It will then arrive via the vena cava, the superior and the inferior parts of the vena cava, and arrive into the right atrium, which is here. It will then pass through the tricuspid valve here. The tricuspid valve is attached by the chordae tendineae, which themselves are attached to the papillary muscles. And the blood's passing through into the ventricles, where it is then pumped up into the semilunar valves here of the pulmonary artery. One thing I should mention is not to be confused by the colours, as red does not mean artery, blue does not mean vein. It's just they're coloured like that to show how oxygenated the blood is. So at this point, the blood is still deoxygenated, even though it's an artery. So it will go then to the lungs, and then the blood will return via the pulmonary vein here, oxygenated, hence the red colour, into the left atrium. And then it will go and pass through the bicuspid valve here, which is often referred to as well as the mitral valve, and pass into the left ventricle, which is the strongest ventricle, and then that will be pumped up into the aorta here, which also has the semilunar valves, which you can't see in this diagram. Okay, so now we're looking at the outside of the heart. It is worth mentioning, even though you can't see it, the pericardium, which is basically the double-walled sac of connective tissue, which the heart is suspended in. You can see the myocardium, which is the basic sort of muscle mass of the heart. Yes, moving on, we'll have a look at the coronary artery. So we'll look at the right coronary artery first, which is this one here, before it splits off into others, and the left coronary artery, which is here, and that splits off into the left anterior descending artery, which is there. Okay. And then it's also worth mentioning the circumflex artery, which is here, and it just runs around the edge. You can't really see it particularly well on this, as the veins covering it, but on this model you can see it's just behind it.